With fruits and vegetables becoming more and more recognized as an essential key to good health, it's no wonder more people include fresh produce in their diets. However, as more people eat more fresh produce, reports in the number of people getting sick after eating one of these foods has risen. But the good news is most of these sicknesses caused by this contamination are preventable. Every person, including you as a produce handler, can be a part of the solution for eliminating possible sources of germ contamination on fresh produce. We're going to look at how simply using good personal hygiene practices, such as proper hand washing techniques, can help prevent the spread of disease due to foodborne contaminations. First, let's look at the importance of food safety. Following food safety rules is an obligation every worker has in order to keep their jobs. Packing houses and food processor firms have been closed down following outbreaks of illnesses that are traced back to the processors. It's important to realize that if you are sick with certain illnesses from food or any type of contagious illnesses, you could contaminate produce you work with and in turn transfer your illness so that you may cause your consumers to become sick. If you are sick, you can also cause others at work to be sick if you don't stay away from the workplace. These chances increase when good personal hygiene is not practiced. Remember, we're all responsible for the safety of the produce. Careful handling of produce as it is harvested is the first step in reducing the incidence of foodborne illness. Good worker health and hygiene is critical to preventing foodborne illness, so critical that most experts point to poor personal hygiene as being among the most common causes of foodborne illness. Maintaining good worker health and hygiene requires a sanitary facility and workers who are healthy, practice personal cleanliness, and who refrain from personal behaviors known to spread sickness. Both co-workers and supervisors should be aware of the health status of workers. Everyone in the operation should be familiar with signs and symptoms of infectious diseases, especially those transmitted through foods. If you have the following symptoms, you may have foodborne illnesses: upset stomach, headache, fever, sore throat, vomiting, cramps, diarrhea, or jaundice, which shows itself with yellow skin and yellow eyes. Because poor personal hygiene plays such a frequent role in the spread of infection, let's look at what's involved in practicing good personal hygiene. To prevent contamination due to poor personal hygiene, it's necessary to know how bacteria or viruses are spread. Common culprits involved in the spreading of infection include unwashed or improperly washed hands or contaminated gloves, sick employees, employees with open cuts and scrapes, employees who touch their faces and mouths with their hands, employees who do not wash their hands after using the restroom, and unwashed and poorly sanitized preparation areas. Personal cleanliness should be maintained by anyone having direct contact with produce. When at home, this is achieved by showering, hand washing, brushing teeth, and by wearing clean clothing. This continues at the workplace, where you start each workday with freshly washed work clothes. And when you become sick while at home, it's very important that you let your supervisor know and follow company policy. If you do happen to become sick while at work, it's vital that you report any of the symptoms we discussed earlier to your supervisor at once, and that you avoid sneezing or coughing near any produce. Also, while handling produce, you should refrain from smoking, spitting, chewing gum or tobacco, eating food, and sneezing or coughing on produce while handling the product. Finally, many tasks in the field may require you to use your hands touching parts of machines or other items that could hold contamination, so frequent hand washing is an effective way to reduce the spread of foodborne illnesses. This is perhaps the most important element of your personal cleanliness. just as you'd expect a surgeon to scrub their hands before performing surgery on you, it's just as expected that you wash your hands before handling any produce. Let's take a look at the steps involved. You'll need a wash sink which has clean running water, an adequate supply of hand soap, a small fingernail brush, and disposable paper toweling. Before starting, it's very important that you remove rings and other jewelry from your hands and wrists. Then, dispense a small piece of paper toweling. It's essential to do this before applying water to your hands, and then place it within easy reach of the sink. Now turn the water on, apply soap to your hands, and rub them together vigorously under the running water for at least 20 seconds. If you can, try to count to yourself in increments of 1,000, like 1,001, 1,002, all the way up to 1,020. Be sure to include the backs of your hands and all exposed areas. Don't forget your wrists and the areas between your fingers. Fingernails are areas where bacteria love to hide, so using the small fingernail brush, be sure to scrub under your nails thoroughly. Hand cleaning requires thorough nail cleaning with the small fingernail brush. After all areas have been washed with soap and water, rinse the soap off. Then pick up the paper towel you'd set aside earlier and use it to turn off the faucet. This is very important because your hands are now clean and the faucet handle is not. So, using this same towel, dispense more paper toweling and then use the freshly dispensed towel to completely dry your hands. Now, your workplace and hand washing stations may have different towel dispensers than what was seen here. Bottom line, you don't want to touch anything after you dry your hands. If you have cuts or open wounds, this would be the time to replace bandaging. It should be replaced frequently after assuring that the wound is clean and dry. While disposable gloves have their place, they should never be considered as a substitute for hand washing. Put them on only after your hands are clean and change the gloves often. A good rule of thumb would mean every time you change activities. Whether it's in the restroom or at the workplace hand washing station, washing your hands properly before returning to work or washing your hands often throughout the workday should be considered extremely important in protecting the produce you handle. To be sure those steps are clear, let's go over them again. Number 1, remove any jewelry. Number 2, use soap and running water. Number 3, lather hands and arms up to the elbows for 20 seconds. Number 4, wash backs of hands, wrists, between fingers, and under fingernails using a nail brush. Number 5, rinse hands and arms under running water. And number 6, dry your hands and arms with a clean, disposable paper towel. Remember to use the paper towel to turn off the water. Hopefully by now you see that personal hygiene may be the most important quality that you convey to others about yourself and the company you work for. By making sure you follow safe food handling practices, you help ensure the food you handle is safe for everyone. Practicing safe food handling techniques protects the produce and it helps protect your job security. Keep up the good work, and thank you.